My name is Mihalachi-Anghel Maria from the Department of Pharmacology and Clinical Pharmacology, Nicolae Stimțeanu State University of Medicine and Pharmacy, Chișinău, Republic of Moldova. Today, I will present our work entitled Smart Inhaler Technologies in Asthma Management, Addressing Low Adherence to Inhaled Therapy. This presentation represents the collective work of our research team under the guidance of the head of the department, Professor Nicolae Bacinski. This topic is highly relevant in current clinical practice because despite significant advances in pharmacotherapy, asthma control still remains suboptimal in many patients. And what is most important that this is not primarily due to lack of effective medication because we have them, but is due to how these medication are actually used in real life. So, if asthma therapy is so effective, why are outcomes still so poor? Because asthma, as all we know, is a chronic inflammatory disease that is affecting almost 300 million people globally. It is associated with recurrent symptoms, with a reduced quality of life and significant healthcare burden. Even in countries with access to modern therapy, many patients remain uncontrolled. They continue to experience exacerbation, emergency visits, and hospitalization. So, from a pharmacological perspective, this is actually paradoxical because we have well established guidelines such as GINA and highly effective inhaled therapies such as beta 2 adrenomimetics or inhaled corticosteroids, and we still have a large proportion of patients that still remain poorly controlled. So, the logical question becomes if the drug works, why don't the outcomes reflect that? Because asthma is not limited by treatment availability, it is limited by treatment use. And the best explanation is poor adherence to inhaled therapy. Adherence rates vary widely because studies show that in real world practice only about 30 to maximum 70% of patients follow the prescribed treatment correctly, and even this may be an overestimation because non-adherence is multifactorial. From the patient side, we have lack of understanding of notion of chronic disease or discontinuation when the symptoms improve and the patient gets well, fear of corticosteroids, or simple forgetfulness. From the therapy side, we have the inhalers that require specific techniques, coordination between actuation and inhalation, and of course, adequate inspiratory flow. If we are talking about the healthcare system side, we have the limited time for patient education, unfortunately, and insufficient follow up. So, adherence is not just a patient issue, it reflects the entire healthcare system. An additional challenge is that non adherence is often invisible. Patients frequently report higher adherence than actual behavior. Clinicians, in turn, rely on subjective evaluation, so this creates a false perception of control. Objective methods such as electronic monitoring reveal significantly lower adherence. At the same time, inhaler technique errors are extremely common. Up to 80% of patients make at least one critical error. For example, inadequate inspiratory flow in dry powder inhalers or poor coordination in metered dosed inhalers. So, even when patients use the inhaler, they may not receive an effective dose. So, in this way, we are dealing with a double problem. First one, not taking the medication. Second one, taking it incorrectly. Another challenge is that we only think that we measure adherence, but most of the time we only assume it. So, if adherence is often overestimated and technique is frequently incorrect, the next logical question is what happens from a pharmacological perspective when inhaled therapy is not used correctly? Everything goes to pharmacokinetics because in inhaled therapy, effectiveness depends not on only the drug, but on how the drug is delivered. So we all know that only a fraction of the nominal dose reaches to the lower airways. The rest is deposited in the oropharynx or is swallowed. Another key role is the particle size. Optimal deposition occurs with particles between 1 and 5 micrometers. In addition, we also have inhalation flow, breath holding, coordination. All these are influencing the drug delivery. Therefore, an incorrect technique leads to reduced efficacy, even if the adherence appears to be acceptable. So, no drug works if it never reaches to the target. And in our case, the target is the lungs. So in this context, smart inhalers have emerged as a targeted technological solution. These devices integrate sensors that record timing of use, frequency of use, and sometimes inhalation parameters, and they are often connected to mobile applications. So this will allow us real-time monitoring, feedback to patients, and data access for clinicians. So for the first time, the adherence becomes objectively measurable. Smart inhalers turn adherence from invisible into a measurable one. So this will allow us to detect non-adherence earlier and understand patient behavior much more accurately. Clinical evidence shows that smart inhalers improve adherence. The patients become more aware of their behavior. First, they improve adherence by increasing patient awareness and engagement. Second, they lead to better asthma control and, of course, fewer exacerbation. Third, they reduce healthcare use, including hospital admissions. And what is the most important, they improve quality of life for our patients. So, importantly, that there is no new drug is introduced. We just simply optimize the existing therapy. So we don't need better drugs. We just need better use of the drugs that we already have. Smart inhalers are part of the broader digital transformation of healthcare. They enable continuous monitoring instead of periodic evaluation. So the clinicians can identify non-adherence earlier, they can intervene proactively, they can personalize the treatment. So this shifts care from reactive to a proactive one and supports the concept of personalized medicine. So in this way, we move from treating exacerbation to the most simple one, preventing them. Up to this point, we have discussed smart inhalers as a technological solution, but in reality, they represent something much broader than just a device. They reflect a fundamental shift in how we approach asthma management. Till now, traditionally, asthma care has been centered around the prescription, choosing the right drug, choosing the right dose, choosing the right combination. However, clinical reality has shown us that this is not enough because even the most effective therapy fails if it is not used properly. So, smart inhalers change this paradigm. They allow us to move beyond the prescription itself and to focus on what truly matters, and this is patient's behavior in real life. So in this model, adherence becomes measurable, technique becomes accessible, and variability in treatment use becomes visible. All this enables a more dynamic and individualized approach to our patient. So instead of assuming adherence, we can monitor it. Instead of reacting to exacerbation, we can anticipate them. So the smart inhalers integrate pharmacology with digital monitoring, transforming asthma management into a continuous data driven process. So, this is not just a smarter inhaler, it is a smarter way of practicing medicine. Despite their potential and their huge advantages, we still have several limitations that must be considered. The most important one is the price. The costs remain a major barrier, particularly in low resources countries. Another one is accessibility that is still limited, and not all patients have access to these technologies. And let's not forget about data privacy and data security. Finally, this integration into healthcare systems will require infrastructure and training. So, therefore, implementation is still uneven across different healthcare systems. In conclusion, low adherence is not only a detail. Actually, it is the core problem. Smart Inhaler offer a promising solution by enabling objective monitoring and supporting personalized interventions. So they are improving adherence, clinical outcome, and of course, patient quality of life. In the same time, non-adherence itself has driven the development of these technologies, highlighting its importance in modern medicine. Key message is that in asthma, success is not only about choosing the right drug, but ensuring it is used correctly. The smart inhalers help to bridge this gap, so moving us toward data driven, personalized care. Thank you very much for your attention. I would like to sincerely congratulate you for this excellent scientific event. It is truly a valuable platform for sharing knowledge and fostering collaboration. It has been a pleasure to participate. Thank you very much and warm greetings and best wishes from Chisinau, Republic of Moldova.